When I say Mona Lisa, you probably think of maybe the iconic painting. Well, today we are going to learn about something called the Mona Lisa Touch, a treatment that is focused on women's health. Dr. Mitzi Barmatz is here to explain what we are talking about. Doctor, thank you so much for sitting down with me.
Thank you for having me. This is great.
So tell me a little bit about the treatment and of course the benefits that come along with it.
So the Mona Lisa Touch was designed in Italy years ago. It's only been in this country for a little over 5 years. And the purpose is specifically to help women that are really postmenopausal and have developed a lot of thinning and dryness of their vaginal tissue. So their primary symptoms are often just discomfort, irritation, even walking, hiking, riding bikes, but also with sexual intercourse, it can be quite painful. And then there are women that have had breast cancer that have been treated, and so they're lacking their estrogen hormone, and so their tissue also becomes very thin and dry. So there's an estimated 30 million women out there that are postmenopausal and suffering from this, and another 3 million that have been breast cancer survivors that are also experiencing it. So the purpose of the laser is to actually slough off the dry, irritated tissue and help the body to regenerate with new blood flow and collagen tissue to make day-to-day activities and sexual intercourse much more comfortable.
And I'm sure ladies that come in that are asking about this treatment probably ask if it's painful at all.
The procedure itself actually is really relatively painless. It takes about 5 minutes of treatment, and it is 3 separate treatments. They're supposed to be given about 6 weeks apart. So, you know, people have schedules. A lot of people around here, especially retired people, are traveling, and we work with them on their schedules, but anywhere from 5 to 8 weeks between the treatments. And during the 5 minutes, a laser probe is placed within the vagina, and this image you're seeing is showing you how it works to increase the thickness and the vascularity and the moisture in the vaginal wall. And that treatment itself, women really don't feel much. They mention maybe a puff of air feeling or a little vibration. The outer tissue, though, is also very thin and dry, and that's more sensitive. So we do put some numbing cream on the area. We leave it on for 5-10 minutes or so, and then wipe it away and do the external treatment, which may burn slightly. As far as afterward, discomfort is pretty minimal. We strongly recommend some ice on the area, a little bit of lubrication, and I have a patient who went and played soccer the same day.
Oh.
I don't think that there's any downtime to speak of.
Okay, and I'm sure this is a subject that women, it's not the first thing that people want to talk about or that they really know who to go to for this. So I'm really glad we're talking about it here, letting people at home know that there is something available. Exactly. And what kind of results have you, and the no downtime is amazing, but result-wise long term?
Yeah, it's pretty fascinating. So after the 3 treatments, many women, and we're putting together some data from our practice itself because we've been doing this for almost a year, and we're seeing 150% improvement in discomfort with intercourse, which is a big one, and dryness. There are even women who've had recurrent urinary infections that seem to benefit from this, although it is not approved specifically by the FDA for that. Also some incontinence. So women that have mild leakage of urine with activities, coughing, sneezing, laughing, a lot of us gals have that, especially after having had children. And the laser is helping that too.
Wow.
Theoretically, after about a year, the tissue may start to thin a little, and so we do recommend sort of a booster once-a-year treatment, which is no different than going in for your annual exam.
Okay. So I'm loving the recovery, I'm loving the downtime, I'm loving that, like you said, it's virtually painless, and this is going to be helping. We saw those stats up there, millions of women that this is going to be helping, and we're getting some of that education out because you guys are actually doing like a seminar.
Yes, so next week on Thursday we have a seminar at our Northwest office on Orange Grove. We're having registration at 5:30. The seminar starts at 6, but it's wonderful because we present to the community all the details of what the treatment entails and give them a lot of information. We have door prizes and a little bite to eat, and it's fun. And women are open and comfortable talking to us. We'll even do a little one-on-one if women are a little uncomfortable. After we give the presentation, we can go off into a private room and talk to the women if they'd like.
That's perfect. A very relaxed kind of atmosphere to get those questions out, come in, get the education. Maybe it is something that's you've been waiting for this whole time that you didn't know was available to help in your situation. And exactly why, Doctor, I'm so happy that you came here today.
Thank you so much
The more we talk, the more we can reach people, and of course it can help them. So I'm going to remind them one more time about that wonderful seminar and just in general how they can reach out to you. So thank you one more time.
Perfect. Thank you.
Oh, absolutely. Now you are invited to attend the Patient Education Seminar. That is on April 6th. Like we said, that registration is at 5:30 p.m. at 2260 West Orange Grove Road. To learn more, call 351-5595 or visit MonaLisaTucson.com.